Hello Scouts, my name is Michael, and today I'll be taking you through the basics of first aid. This will not only help you with rank advancement, but is very useful and applicable information in any situation. The first aid covered in this video will encompass the requirements for Tenderfoot and even some from second class, so be sure to follow along in your book or take notes of your own. Let's get right into it. First up is simple cuts and scrapes. This is definitely the most common injury on this list, so it's good to know how to treat it easily. First, clean off the wound with either a medical wipe or soap and water if available, and then apply a triple antibiotic ointment. After this, follow up with a dry, sterile dressing or adhesive bandage. This will allow the wound a chance to heal itself and prevent infection. Up next, we have blisters. This is the most common injury during hiking, so be sure to wear shoes that fit well and are broken in to prevent blisters in the first place. And as an added tip, never hike in wet socks. That doesn't end well for anyone. Be sure to never pop a blister, as it allows bacteria to enter your body much easier. Cover the affected area with a piece of moleskin and go about your activity. If the blister is going to burst inevitably due to your work conditions, drain the fluid using a sterilized pin and bandage normally. This will allow you to continue your activity without putting yourself at risk for infection. Next up, we have burns. Burns are going to be the most common injury when cooking, utilizing a campfire, or operating around any other source of heat. Burns are broken up into three categories, the first of which is a first-degree burn. First-degree burn is typically only a reddening of skin and mild irritation, such as a scald from touching a stove or mild sunburn. To treat this kind of burn, simply run the burn under cold water or apply a cool, wet rag until the pain goes away. Never apply ice to a burn. Second-degree burns are typically signified by blisters forming, as the damage has spread to the tissue beneath the skin. For treatment, submerge the burn in water or apply cool, wet cloth until the pain subsides, then cover with a sterile gauze pad. Try not to break any blisters, as it could lead to infection. To finish off the third category, we have third-degree burns. Third-degree burns are when the damage has gone through the skin and the tissue beneath it. The skin will typically be burnt away and the flesh blackened, and the burn may be so deep that the victim's nerve endings scorch so that they feel no pain. Call 911 immediately if a victim has third-degree burn, and don't try to remove any clothing, as it could be fused with the skin. Wrap the injury in a clean, dry cloth and treat for shock until help arrives. Insect bites are extremely common in the outdoors, and sometimes unpreventable due to the time you normally spend outside on a campout or backpacking trip. As a general rule, if a victim ever begins to experience difficulty breathing after being stung or bitten by an insect, call 911 immediately and treat for anaphylactic shock. Insect bites are mostly small injuries, but they can lead to serious injury or death if the patient happens to be allergic to them. Ticks are small, hard-shelled creatures that bury their heads into your skin to feed. If you're bitten by a tick, simply use tweezers to remove it. Grab as close to the mouth of the tick as possible and gently pull it until it is freed from your skin. Wash the wound with antiseptic and apply antibiotic ointment after the removal is complete. If you develop fever symptoms, talk to your doctor, as ticks can lead to Lyme disease or Rocky Mountain spotted fever. Chiggers are very small spider-like things that feed on your skin. Chigger bites are almost unnoticeable until after they drop off of your skin, so treatment is pretty much just applying lotion to treat the immense itching sensation that their bites generate. Spider bites are very common, and most of them are pretty harmless overall, but a few are a very large threat to humans, such as that of a black widow or a brown recluse. If a victim suffers from swelling, redness, pain, nausea, vomiting, or other symptoms after a spider bite, get the medical attention immediately and treat for shock. Bees or hornets won't usually sting you, but sometimes the worst happens and they decide to sting you anyway for some reason. Scrape out the stinger with a credit card or a pocket knife screwdriver blade and apply an ice pack to reduce swelling. Venomous snake bites can be seriously threatening to a person's life, and while relatively uncommon, you should be able to treat it in case of an isolated incident. Keep the victim calm and gently wash the wound site and remove any jewelry before the area swells. Resist movement and keep the bite at the approximate level of the heart. Don't apply ice or take any other action towards their health. Call 911 and try to get the victim to help as soon as possible. The venom will kick in for about an hour, so get them in a hospital or to a doctor before then. Encourage the person to stay calm at all costs, as an increased heart rate will spread the venom faster, and treat for shock as needed. While nosebleeds may appear bad, the bleeding is usually not as intense as it appears and will stop after a few short minutes with minimal care. Have the person sit leaning forward so the blood does not run down onto the back of their throat, and pinch firmly but gently, high on the nose just underneath the bone. Hold a cold compress against the nose, and the bleeding should stop after no more than 10 minutes. If it continues for longer than 15, seek medical attention. Choking is a hazard that can come up any time that food is involved, so always be prepared to take action. If the person is choking and cannot breathe or cough, tell someone to call 911 and begin treatment. Stand behind the person and bend them over your forearm. Strike their back between the shoulder blades 5 times. If this does not clear the airway, position your arms around their waist, make a fist with one hand, grasp with the other, and perform up to 5 abdominal thrusts by thrusting your clasped hands inward and upward. Repeat this entire process until the airway is cleared. Treat for shock if necessary. The last injury we will be covering is shock. Shock is not caused by any one injury specifically, but rather the stress that any injury is capable of providing on the body. Symptoms of shock include restlessness, weakness, confusion, pale and moist skin, quick and weak pulse, nausea, and extreme thirst. Treat every accident victim for shock, even if there are no signs. Call for help, be sure to eliminate any hurry cases that might be causing the shock, such as a clogged airway or an open wound. Lie the person down and raise the legs about a foot above the rest of the body to move blood to the vital organs. Be sure to keep the victim warm with blankets or sleeping bags. And there you have it. These are all the basic first aid requirements for your journey through scouting, and also the fundamental level of first aid knowledge. Now go out there and treat some minor injuries.